Okay, welcome back to TWiGH. TWiGH stands for This Week in Global Health. This week we're going to be talking about two conferences, well, two organizations, and both organizations had a conference this week. The one is the Consortium of Universities for Global Health, and the other is Unite for Sight. And we had members from the TWiGH team going to both of these conferences. They're going to tell you about them, and they're going to tell you a bit more about these organizations, so stay tuned. We're going to have a lot of fun. Just quickly to let you know, if you're watching us live, please feel free to interact with us on Twitter. You can tweet us. We're using the hashtag TWiGH. If you're watching this on YouTube in the future at some point, well, you can't interact with us live, but do leave your comments in the comment box below, and we'll respond to those. And of course, if you're listening to this on our podcast, you can email us at hello@twig.org, and we will respond to that. Okay, before we carry on, let's introduce the panel. We're going to start off with Chris. Chris, talk to us.
Good afternoon, morning, or evening, everybody. I'm Chris Ronson, coming to you from San Francisco, California. Going to be discussing the time that we spent at CUGH and go a little in depth into the organization itself and what they stand for. Also wanted to make a quick announcement for everybody. If you were wondering where we were last week, we were all sort of in transit to all of these different events, so we weren't able to do a live broadcast. But what we did do is put together a special episode that you can see on our website. It's an interview that was conducted with Dr. Mohammed Ali Pate, who is the former Minister of State for Health in Nigeria, as well as a visiting professor at the Duke Global Health Institute. So be sure to check that out at twig.org.
Okay, thanks very much, Chris. And a big thank you to Silzen for organizing that interview and for Jessica for conducting it. That's really good of you guys. Next up, Katie. Katie, talk to us.
Hi everyone, my name is Katie Jackson, and it is evening here in Stockholm, and I've just returned, so I'm getting over jet lag, but it was a really exciting time in Boston, so I'm excited to tell you guys about it.
Okay, fantastic. And Jessica, over to you.
Hey everybody, I'm Jessica Taff, and I'm coming to you from the Washington, D.C. metro area. And I attended the Global Health Innovation Conference at Yale this weekend, and I'm really excited to tell you just about some of the highlights from that.
Okay, looking forward to hearing about that. And not last but not least, good old Brian from Johns Hopkins.
Greetings. Hi, everybody. It's Brian Simpson from Global Health Now at the Johns Hopkins Bloomberg School of Public Health. I'm going to be bringing you a couple news stories that we've highlighted in Global Health Now, and a very brief reflection on my visit to the Consortium of Universities for Global Health Conference in Boston, where I got to see everybody, or almost everybody.
Okay, because that was the first time that I've actually never met any of the people that are on this panel. I mean,
Is that why you can't get my name right?
Why I always get
Is there an award for that?
So we talk more than once a week, and we've never met. So this week, for the first time, a lot of the team met in Boston, so they're going to tell you a little bit. But before we carry on, we're going to jump right in with Brian and his Global Health News update. Over to you, Brian.
Sure. Just got a couple stories that really stood out to us so far this week to bring you in to TWiGH. The first one is Tom Murphy at Humanisphere has a terrific piece that I think everybody should read about a Ugandan program to send 283 physicians from Uganda to the Caribbean country of Trinidad and Tobago. So you may be wondering why a country that has one doctor per 24,725 people, Uganda, is sending medical professionals to the Caribbean nation of Trinidad and Tobago that has one doctor per 833. So a lot of people are asking this kind of question, and there's been a huge outcry both from activists within Uganda and outside the country as well. So the government is saying that this is good for bilateral relations and that the physicians and health professionals can send money back, but there's plenty of people out there who think it's a very bad idea. So anyways, it's kind of one of those shocking things that is out there in the news and is worth paying attention to.
And really quickly, actually, for anybody Tom Murphy, I follow him on Twitter. I believe it's at A View from the Cave, and he does a lot of amazing pieces. So somebody to put on your Twitter sphere radar if you don't already follow him. Sorry, Brian.
Yeah, no, absolutely. Tom Paulson and Tom Murphy, both at Humanisphere, do terrific work, so definitely worth checking out. So the next piece, and now this one is just out of sheer interest. It may not have a huge impact immediately, but I found it pretty astounding that researchers in the UK have referred to a recipe for a 10th century recipe for an eye salve in Bald's Leech book. That is actually they found to be proven effective against MRSA. So it's rather amazing that something from so many centuries ago can actually be useful today in terms of fighting antibiotic resistance. So anyways, I know it. I think it's incredible, and I love that idea of like researching things that happened back in the past, way back, to find something useful today. And so, just so you know, the ingredients in this salve included garlic, onion, copper, wine, and ox gall, otherwise known as cow's bile.
I have
Amazing.
3 of those things on a regular basis, and it's not the bile.
That's really interesting because and maybe at some point I will talk about it with the permission of my mom, but she's told me so my mom's from Paraguay and, grew up with all these diseases, and she's got some really interesting stories about local cures that aren't your traditional medicine. So that's interesting to hear that they found that to be actually effective, because the entire time I'm just so skeptical of these things that my mom's told me about, and she's like, they worked. I'm like, all right, so the proof is in the pudding right there, I guess.
Yeah, that's exactly. And just for people watching that don't know what MRSA is, it stands for methicillin-resistant Staphylococcus aureus. So it's Staphylococcus aureus is a microbe, and it's usually just a friendly microbe. You've got it on your skin, you've got it in your nose, but it can cause infections. And this is a version of that bug that's very, very difficult to treat. And we sometimes see it in hospitals. They're called nosocomial infections. So it's hospital-acquired infections. Terribly difficult to treat. So when something like this comes up, an actual effective treatment, of course, eyebrows get raised, and it's good to hear that may be promising. Thanks, Brian. More stories, Brian.
Oh, just one more. Just wanted to say how much I enjoyed meeting everybody at the Consortium of Universities for Global Health Conference in Boston. It was absolutely fantastic to connect with so many people who are so passionate, so smart, and so committed to global health. And that certainly includes my TWiGH buddies here, Chris and Katie, and also Deepti too. So it was great to see everybody. And at the conference, we also launched, for the first time, the Global Health Now website. So we are online. Woo!
We love the website, Brian. It's fantastic.
Well, thanks so much. It's globalhealthnow.org, so please check it out, and definitely look for on the homepage the box that we have for TWiGH, and so you can keep up with the latest shows there as well.
Okay, and if you're watching this and you have not subscribed to the Global Health Now newsletter, you should. It comes out every weekday, and it's fantastic. We all read it all the time. It actually forms the basis of a lot of what we present on the show. So thanks very much for that, Brian.
Awesome. Great. And great to see everybody. I'm going to go ahead and sign off here from Baltimore.
Okay. Thanks for coming in,
Brian.
Brian. Take care.
Bye-bye. Take care.
Okay, Chris, now, you are going to tell us about the CUGH conference. Talk to us. You were there this last week. Did you have a good time? Who was there? What did you do? Who did you meet? What happened?
Had a fantastic time, actually. So very similar experience to Brian. It was also, like he said, our very first time all meeting together, which is strange because we communicate at least once a week, and getting to meet people in person is always a bit of a riot because you sort of half expect there to be a giant computer screen between the two of you. But it was a phenomenal conference, and I took a lot away from it. And, I left really advocating for the organization as a whole. They have done a lot of wonderful stuff, and it was a great experience. We had a really good time.
So, Chris, could you tell us a little bit about CUGH, the Consortium of Universities for Global Health? Who are they? Tell us all a little bit about that organization or that institution. Can't say the word. Institution.
You're having a me day. Okay, so CUGH. CUGH stands for the Consortium of Universities for Global Health, and their conference is actually the same as the organization name. They started in 2008 when a group of about 25 to 30, I'd say concerned, universities came up with a question: how can we better collaborate together in this emerging field of global health? Relatively speaking, global and international health are fairly new onto the academic scene. There are some older programs, but a lot of the expansion within this discipline has been done within the last decade. Everybody read Katie's thesis. So 7 years and 6 conferences later, CUGH is literally bringing people together, both over the internet as well as in person. This includes students and young professionals, mid-career professionals, everybody. And the aim is to build interdisciplinary collaborations and facilitate the sharing of knowledge to address the global health challenges that are emerging and that still need a lot of work.
Okay, interesting stuff. Now, Katie was at the conference with you, so I'm going to ask her to talk a little bit about the actual work that CUGH do and how it is what it is that they're doing to accomplish these goals.
Yeah, so apologies to Chris, I made her read my thesis. But CUGH's goal was really, this conference was really great because it really focused on education for me. But the goal of the organization is to assist members in sharing their experiences and expertise across education, research, and service delivery. And it's dedicated to creating equality and reducing health disparities all over the world. The really great thing is that they aim to promote mutually beneficial, long-term.
Lose Katie?
Okay, we may have lost Katie. She's frozen.
Okay.
So
I can
while we
pick
waiting,
up where she left off.
yeah, Chris, why don't you jump in where Katie left off? You were there.
Okay.
Talk to her.
I was. So what she was basically saying is that their
benefit
ultimate...
from being part of CUGH.
Oh, hey, so we missed a lot of what you said. Could you quickly recap that? Because you froze a little bit about like the beneficial partnerships and what it is they're trying to accomplish between universities.
Excellent. Love technology challenges. The really great thing is that they aim to produce or promote mutually beneficial long-term partnerships between universities in resource-rich and resource-poor countries, and this strengthens the institution's capabilities to address global challenges, and these challenges really affect us all.
Yeah.
The best thing is that they just created something where you can have individual membership, so if you're not under an institution that is part of CUGH, you can still join and benefit from this organization. Sorry.
Okay. Thanks very much, Katie. And just so that if anyone's watching this on YouTube, if you had any doubt that this is a live show, there you go. Nothing can be edited. It's
Every time.
Chris, while you were in Boston, I believe that you did some video interviews of some rather spectacular people connected with CUGH, and we're going to be showing those videos on the TWiGH webpage quite soon. Could you just tell us a little bit about them?
Indeed, I can. So we did have this amazing opportunity to sit down with two of the leaders of the Consortium of Universities for Global Health, and that would be Dr. Tim Brewer and Dr. Keith Martin. They met with us the Wednesday, so literally the evening before the conference. They took time to have a short, about 25-minute interview with us to sort of let us know and go into their mission, their purpose, things that they're most excited about as far as this conference and as far as the organization in general. Dr. Brewer, for those of you who don't know, is actually chair of the board of CUGH and vice provost for interdisciplinary and cross-campus affairs at UCLA, while Dr. Keith Martin, not to be confused with Dr. Greg Martin, served as the executive director of CUGH and was a member of Parliament in Canada for many years. So
my
two wonderful...
name is Keith.
Really?
Oh.
Yeah, my father's Keith Martin.
So different Keith Martin, Dr. Keith Martin. Yeah, but no, it was great, and we do have that video. We're going to break it up into a couple of different segments for you, but I highly recommend checking it out because it goes more in depth into their beliefs as an organization, what it is they're trying to accomplish, definitely in a time frame that we aren't able to cover in a single episode. So.
Okay, super duper. Katie, the people watching the show, the people that watch TWiGH, why would they be interested in CUGH? What can they get from this organization? How do they engage? Could you just talk to us a little bit about that process?
Yeah, definitely. I mean, it's just a great place for students, young professionals, or SIPs, can go to check out. So it is really an amazing hub for global health education. They have an education committee that works tirelessly, volunteer, that has more than 5 subcommittees working on various topics like defining global health competencies, looking at what the workforce is like for graduates of global health programs, and setting ethical standards for short-term medical electives abroad, among others. So it's really great that they look into this for us.
Yeah, and in addition to that education committee and their subcommittees, their website is a wonderful resource for all things global health related. They have program information, events, special interest groups, and their interest groups are everything from like addiction and mental health to innovation, health economics, neglected tropical diseases. And I wanted to take a moment to share sort of an excerpt from our interview because I think that it so comprehensively shows that they're advocates for what they actually stand behind what it is that they're doing. And so Dr. Martin, when we were talking about, what do you think our biggest challenges are, he had said one of the challenges that we have as we work to be able to bring the non-medical disciplines into what we're doing is to convince them that they are a part of global health. And maybe to use health is not the right thing or not the right word to use. We are talking about human well-being and all that it includes, which is politics, policy, environmental health. Just because you're doing law doesn't mean you're not working on global health. Because you're an engineer, you're definitely involved in global health. And they're truly advocating and trying to get people to work in a transdisciplinary capacity, which was very rewarding and I'd say very inspiring too.
Yeah, absolutely. Couldn't agree more. That's fantastic. Katie, you had some takeaway messages from the conference too.
Sorry, I'm just going to unmute myself. Yeah, no, it was really great. We had Keith's little soundbite there, and Dr. Brewer also. He mentioned that the thing he was most excited about this conference was interacting with students and professionals. He said every year he gets inspired and he gets reinvigorated of the subject through students and professionals, through their point of view.
Okay, super duper, good stuff. Now, Jessica went to another conference. Was it in Boston as well, Jessica? I think it was Unite for Sight, which is the Global Health Innovation Conference. Yeah, was okay, but that side of the world, the east coast of the States. Could you tell us a little bit about the conference?
Yeah, right. So yeah, the conference, Global Health Innovation Conference, was at Yale University, and it's put on by Unite for Sight every year. Now, Unite for Sight is an organization that's focused on healthcare delivery. They work to apply best practices in eye care, public health, volunteerism, and social entrepreneurship to achieve the goal of high-quality eye care in general for everyone. So like I said, they put on this conference every year, and it's currently the world's leading and largest global health and social entrepreneurship conference. This year, there were more than 2,200 participants from all 50 states, and there were more than 55 countries represented there. Now, to go on a little further, the goal of the conference really is to exchange ideas and best practices across disciplines, again, with this whole transdisciplinary theme that you guys were talking about from CUGH. And they do this because, like you said, there's so many ways to improve public health and international development. But they really focus specifically on the work of young innovators. So there were so many students there, and they got to showcase different projects that are using data, outcomes, and input from local communities to make positive changes.
And I'd just like to add really quickly, too, that I recently remembered Unite for Sight puts on a ton of really wonderful webinars, too. And so that's another way that they sort of facilitate outreach to different demographics in different countries and try to integrate as many people as possible. So they do a lot of great work with their informational webinars and tutorials, too. So.
Yeah, fantastic organization. Really like them a lot. Jessica, of what you saw there, were there any projects or innovations that you really want to highlight that caught your eye that you want to just tell us a little bit about? I can't say words today. Carry on. Talk without me.
I would love to. Okay, so we both Solzhen was with me as well, and we did interview a lot of people that were there, including some of our TWiGH fans. And the highlight for some of them were the keynote speakers that were super inspiring, like the Minister of Health of Rwanda, Agnes Bingawahu, I think, and Joy Mukherjee from Partners in Health. But my favorite part was getting to meet these two amazing female engineering seniors from Duke. And I don't like them just because they're from Duke, but I like them because they're putting on a project in Kenya where they're empowering girls in engineering, which that's such a cause so close to my heart. So basically, these girls started an engineering club at a school in Kenya, and in this they taught 53 young women how to build flashlights from local materials like water bottles and plastic folders. They've raised over $5,000 through Indiegogo and an award from USAID. But they still need more money to continue the program. So this was just absolutely fantastic because it's all about promoting women in STEM, which like I said, it's an issue close to my heart here in the United States, but even more so in places where education for girls is even harder to obtain and encourage there. So when they're getting girls into science, fantastic.
Jessica, is that Indiegogo campaign still live?
No, it's finished, but I think they're going to start another one.
Because
yeah, and if everyone wants to look them up.
When and if they start a new Indiegogo campaign or some sort of crowdfunding campaign, let them know to let us know, and we'll just give that a bit of profile here on TWiGH, and we can send it out in our newsletter, stick it on our webpage, links to it, put it on YouTube, because I would love for us to support that kind of initiative. I think it's fantastic.
Yeah, definitely is. That's very impressive. And of course, it's like utilization of resources. Fantastic.
Oh, it was I fell in love, and I became a total fangirl going up to these girls, and it was like, oh my God, I'm so inspired by you. I mean, they probably thought I was a little weird, but no, and we actually do have a clip. Solzhen and I took a video of it, so you guys can talk. There'll be on our website more information about the campaign.
Yeah, we should bring them onto the show. See if we can reach out to them and bring them onto the TWiGH show sometime.
If you're watching,
we will.
Yeah, good. I've been saying for a while now, and we are going to do more of this, and that is to get young people with good ideas, bring them onto the show, give them an opportunity to speak about what it is that they're doing, and if they're doing a crowdfunding campaign, then we can also promote that and try and help them get a little bit some resources. So let's do that. Any other projects you want to talk about, Jessica?
Yeah, but I think we can talk about that maybe a little bit in the discussion.
We'll talk about it in the discussion section. Just quickly, Katie, Hades Careers Corner. Do you want to just talk about careers, job opportunities, or where people can go in order to find out what's available in the workspace in global health?
Definitely. So I'm going to take this opportunity to plug the events that we went to, not just the events, but the fact of going to events. Brian spoke about it. We all were excited to meet each other, meeting people in person and being inspired. Tim Brewer said, go to a session you don't know anything about, because that is the way that your mind gets stimulated. So I'm going to use Hades Career Corner to first say that, there's lots of events that don't, that are free, that are in your community, at community colleges or universities or just community centers. Please, I encourage everyone to go to these events. The people that you meet and the world you get brought into is nothing short of amazing. Secondly, there is the opportunities and resources section on the CUGH website. Being a conglomerate of all the universities, they have an incredible wealth of information there. They have jobs, funding, fellowships, internships listing, and the resources section has a forum, useful links for other organizations, educational info, and global health program info. I'm also going to be working with them to put my info that I did of my thesis on there, so you can find that there as well.
Okay, fantastic. And we're going to have a link to those web pages in the show notes, so keep an eye open for that. The show notes will be underneath the YouTube video if you're watching this on YouTube. We'll include it in the podcast show notes, and of course you can subscribe to our newsletter, and we get the show notes emailed to everyone on that subscription every week. Right, that's the end of the live part of the that's the end of the part of the show that's going to be on YouTube and in the podcast. But if you're watching this live, don't go away, stay with us. We're going to carry on and have a discussion section, and we're going to answer questions that might have come over Twitter, etc., etc. But if you're watching this on YouTube, this is the end of the show. Feel free to watch some of the other videos. Go to our webpage, twig.org. Thanks for watching. Come again next week, same time, same place. Until then, don't do drugs, always do your best. Don't ever change, always use a condom, etc., etc., so on and so forth.